Today we're going to talk about tracing, which is the second step after testing, right? You test, you now know what's happening on the infection rate. You can gauge your decisions based on that infection rate. Second step is trace those people who came up positive. All right, you tested, you have the data, you can adjust the opening valve, reopening valve. Now you trace. When you get a positive, you talk to that person and trace back who they have been in contact with. You then test those people, you then isolate those people so you don't increase the rate of infection. That's what tracing is. Faster you trace, the better. You want to test right away. You think you have symptoms, you think you were exposed, come and get a test, do it today. Once you get that test results, you have data on what's happening with the infection spread. You then right away, as quickly as you can, trace that person. Who have they met with? Who have they been in close contact with over the past 14 days? And you then contact those people and say, you may have been in contact with Dan. Dan tested positive. You should check your symptoms. If you develop any symptoms, let me know right away, and we'll bring you in to take a test. That is tracing. The problem is, it's not rocket science to do it on an individual basis. The problem is the scale that we have to do this at. Yesterday, we tested 4,681 people who were positive. Yesterday, 4,681 people were positive. How do you now communicate with 4,681 people, trace back all the people they've been in contact with over the past 14 days, close contact, and contact those people? That is an overwhelming scale to an operation that has never existed before. We do tracing now, but on a very limited basis. That's why this is so hard, tracing. In and of itself, one person, it's easy. 4,681 on one day. Today, we'll have another 4,681 people. So just think of the scale of the operation. Last week, we announced that Michael Bloomberg would lead the first ever testing, tracing, isolation program. Figure out how many people, how to train them, what technology, how do we do this? And it's of a scale never been done before. And by the way, we need it tomorrow. There is no time to go get a university to do a study and a blueprint and then put a plan together. We need it tomorrow because we're literally doing it right now. We're doing the testing. We're coming up to scale on the testing. You need the tracing to come up to scale to meet what we're doing on testing. The estimate so far is you need 30 contact tracers for every 100,000 people who are in the affected area. Statewide, that would be about 6,400 to 17,000 tracers, depending on what happens on the testing rate. The more people test positive, the more tracers. The less people test positive, the less tracers you need. So these things are all linked, right? The better you do at reducing the spread of the virus, the fewer people test positive, and the fewer people you need to trace back. But it will require, under any estimate, a tracing army to come up to scale very, very quickly. And Mayor Bloomberg has put together a great team who's going to work on this. He has great talent in his Bloomberg Philanthropy, Johns Hopkins University, working together with the New York State Department of Health. This is that undertaking, and it is massive, and that's why bringing in a person with the talent of Mayor Bloomberg and the experience of Mayor Bloomberg to do this is essential.